Welcome to Mental Health in the Workplace, a brief study on the importance of mental health programming within companies by Dr. Rod Brace. Statistics show the rate of mental health conditions reported has decreased from 46 million in 2001 to 44 million in 2016. On the surface, this appears to be a move in the right direction. However, while the number of uninsured individuals has decreased by 2.5% in the last 4 years, an alarming 1 in 5, or 9 million adults, have reported having an unmet mental health need. In addition, the mental health workforce is understaffed, with some areas experiencing a shortage of 4 times the number of individuals needing assistance to every single worker. The number of suicides remains at an alarming 1 every 40 seconds. In fact, the ideation of adult suicide rose over the last 4 years, despite increases in mental health reportings. The highest number of suicides being reported in the wealthiest countries among the best paid workers. A startling 71% of adults reported at least one symptom of stress, including headaches, fatigue, and panic attack symptoms. Many mental health conditions come with physical ailments as well that need treatment, making this a costly healthcare oversight. By combining medical and behavioral health care services, the United States could save from $37.6 billion to $67.8 billion a year. About 63% of Americans are part of the U.S. labor workforce, making the workplace a key location to effect change. Research tells us failure to acknowledge an employee's mental health can hurt a company's bottom line. More specifically, poor mental health and stress can negatively affect employees' job performance and productivity. Time off due to related physical ailments can increase. Lethargy and depression can severely impact creativity and innovation, pulling a company's productivity down. Mental health issues make it difficult for employees to engage with their work and their colleagues. Previous studies have shown that disengaged employees cost companies approximately $16,000 each per year, more for higher wage earners. Communication abilities can be negatively affected, creating bottlenecks and production errors, client and customer satisfaction issues, and team frustration. Approximately 17 to $44 billion is lost to depression alone each year. Depression interferes with a person's ability to complete physical job tasks about 20% of the time and reduces cognitive performance about 35% of the time. Surprisingly, only 50% of employees who report moderate depression and 40% of those reporting severe depression receive treatment for their depressive symptoms. When depression and other mental health care go untreated, employees quit or are fired repeatedly. Considering the cost of replacing a single worker is estimated at 3 times their monthly salary, the strain of mental health conditions on businesses can become astronomical. In contrast, for every single dollar spent caring for a mental health issue in employees, $4 is returned to the economy. Every business's approach to managing their mental health care will be different. The following 3 companies have programs that are unique, successful, and noteworthy. Our first case study is EY. EY, formerly Ernst & Young, launched a We Care program a few years back to educate employees about mental health issues, encourage them to seek help if they need it, and to be supportive of colleagues who might be struggling with mental illness or addiction. EY is no stranger to mental health care and concern for their employees. In 2015, EY opened the conversation with the Are You OK initiative. The goal was to get the culture of concern started. Since the advent of the We Care program, 2,000 EY employees have attended these sessions, which always has a senior level sponsor and a mental health professional on hand. Typically, someone in leadership kicks it off by sharing a personal story. This sends the message that anxiety and mental health issues are not toxic and attendance to a program is not a career dampener. The company also has an employee assistance hotline that offers confidential support. Calls related to anxiety have increased 30% over the last few years. They want employees to identify the symptoms in themselves and others and report them for early assistance and care. Our second case study, GCI Health, hosts a variety of options to open the line of communication and destigmatize the concept of mental health care. Recently, they hosted a variety of mental health activities like tea time breaks, brain food carts, and a conference room set up with coloring books to distress their employees in a creative way. They also hosted a hashtag mental health awareness month happiest hour, where instead of alcohol, a variety of vitamin-rich juices were on the menu. Finally, American Express does more than manage a credit card right. Their Healthy Minds program, which stemmed from their decades-long employee assistance program, now provides part-time counselors at each employee clinic and has hired a clinical psychologist to run the Employees Assistance Program in order to continuously improve their services. In 2014, the Affordable Care Act made mental health services an essential benefit that new individual insurance plans must cover. Unfortunately, a recent survey of 314 U.S. companies found that only 25% had programs to reduce the stigma surrounding behavioral health issues. However, an additional 35% were at least considering putting such programs in place by 2019. How does a company put such a plan in place? And what should be included are key questions to implementing companies' wellness programs. In many of our examples mentioned earlier, the companies began with the ABC's pathway. They approached their leadership, built mental health care into their benefits, and created an accepting culture where sharing the struggles of a mental health disorder or caring for a loved one with a mental health disorder didn't mean the end of their career advancement. To begin, companies must have the support of their leadership teams. With the availability of online mental health awareness webinars and conferences, providing the information needed is readily available. Relia Healthcare can assist. The statistical support for the costs associated with such a program, when compared to the financial impact to a company's bottom line when it is not, is irrefutable. Oftentimes, education is all that is needed. Once a company has full approval and backing from their leadership teams, committees containing leadership, employees, and mental health professionals, preferably those with personal experience with mental health care or with family who needs mental health care, can begin to develop a benefit package that best suits the needs of your company. These benefits may include easy access to mental health care through on-site counselors, similar financial provisions for both physical and mental health care, online or telemed options for mental health care, and or similar means of care. With the backing of leadership and a plan in place, the next step is to develop an accepting culture where the stigma of mental health care is removed. Employees will participate in the health care they need when they feel safe in stepping forward. This can be developed through equality in mental and physical health treatment, such as mental health days being treated with the same weight as sick days, mental health care events that educate all members of a company and give the information they need on a variety of topics, like how to recognize warning signs and how to practice wellness techniques. Finally, stories of personal experiences with family members and self-diagnoses should be shared from all levels of a company's hierarchy to remove the misconception that career growth is stymied or stopped if mental health is needed. When a positive mental health care program is adopted and incorporated into a company's culture, everyone benefits. For more information, contact Relia Healthcare today.